Do you suffer from knee pain? Do you know that 50% of patients that we see in physical therapy that suffer from knee pain, it's actually coming from their kneecap, or what we call in the medical field the patellofemoral joint. A very simple test that you can do is just put your hand on your knee joint, especially the kneecap, and then just bend and straighten your knee. If you're feeling like a clicking and grinding sensation, that's actually the kneecap grinding on the bone underneath it. And that is a very simple fix. A lot of people think when they have knee pain, they're like, oh my gosh, do I have arthritis? Do I need to go get a knee replacement? Especially senior citizens. But really, what it is it's just the kneecaps not tracking properly. And that's just a very simple fix with some very simple exercises that we can do. Applying a little bit of ice packs a couple times a day, giving it time to calm down and rest. We can usually get rid of that knee pain. In fact, we have a 95% success rate of getting rid of knee pain without surgery. Hi, I'm Dr. Steve Ryland, physical therapist, 29 years experience. And through the years, I've seen so many patients that have waited, gone and gotten an x-ray, gone and had an MRI, then they're just referred to physical therapy, and then we treat them for 4 to 6 weeks, doing great, no problem squatting, going up and down stairs. And it's a really, like I said, it's a simple fix. 50% of those patients, it's literally the kneecap that is just not tracking properly. Typically what happens, you have a structure on the outside of your leg called the iliotibial band. Most people have heard of iliotibial band tendonitis, which is extremely painful. Well, sometimes that band will just tighten up. It'll pull that kneecap ever so slightly to the outside. The underside of the kneecap, the patella, is a sesamoid bone. You only have a few sesamoid bones in your body, with the kneecap being the largest. And essentially what happens is that backside of the kneecap is V'd like the hull of a boat, and it normally floats. The kneecap is really just to protect the tendons. It's to lubricate and also protect the tendons in the front of the knee as that kneecap glides up and down. And when that kneecap starts to shift slightly, usually to the outside, what happens is instead of it free floating through that normal groove, it starts to grind. And just like a toothache, the backside of that bone can get really raw and inflamed. What we do in physical therapy is we teach you exercises to strengthen up the proper muscles. We loosen up the IT band through doing some manual techniques, and then we educate you on how to use ice a couple times a day. And usually within 4 to 6 weeks, that pain's gone, and then we teach you how to keep it gone for a long period of time. Most of our patients do not come back for the same issue. We do have a lot of repeat patients, but one may come in for a knee one time, a shoulder the next time, but we have a really good track record, 95% track record of getting our patients, getting them back out into the community, walking, exercising, staying healthy, and living an active lifestyle. So if you have knee pain, do not wait. Pick up the phone, call us, 321-622-5707. You can also go to our website, which is aligntherapy.org, and on there that you can request an appointment. Easiest way is just pick up the phone and call. Most places you do not need a referral. In most states, 50 states, direct access. Some insurance companies still require it, but we'll be able to tell you that on the phone whether you need it or not. But the main thing is, let's get you in. Let's get it fixed. Let's keep you active. Let's keep you moving. Pain is your body's way of telling you that something is wrong. And knee pain, very, very fixable. After a thorough evaluation, we'll be able to tell you exactly what's going on and then put you on a path to recovery as soon as possible and get you moving again. Thank you so much for watching this. Don't forget, if you like this video and got something out of it, please hit like. Also, feel free to share it to your friends, neighbors, family, etc. And then pick up that phone and give us a call, and also subscribe to our YouTube channel. We appreciate you. Have a great afternoon.